Good afternoon, everyone, and welcome to the National Early Childhood Family Network webinar titled Help Me Grow, State Perspectives from Connecticut, New Jersey, and Alabama. We have an incredible panel of presenters gathered today from these three states. And so it promises to be a very, very informative webinar. We're so glad you decided to spend part of your day with us. My name is Jane Walker, and I'm from an organization called the Family Run Executive Director Leadership Association, otherwise known as FREDLA. FREDLA is privileged to be able to support the Early Childhood Family Network through a grant from SAMHSA, and which is through the National Technical Assistance Network, which is operated and coordinated through the University of Maryland. So we're very grateful to SAMHSA and the TA network, and our tech savvy person here today, Gary, who is connecting all of us together through the miracle of WebEx. So with that, I would like to turn it over to David Armstrong, who's going to talk a little bit about the Early Childhood Family Network. David?
Hi, Jane. Thanks. Good afternoon, everyone. Can you hear me?
Yes.
Great. Fantastic. Listen, I'd like to thank y'all for taking the time out of your busy schedule to join us. In February 2018, a new family was born with the goal to make families strong everywhere. 55 family members who were connected to launch grantees gathered at SAMHSA for a Family Leadership Summit and committed to creating the National Early Childhood Family Network. Since February, family members across the country have been meeting virtually to turn their vision into reality. We have done so much over the last couple of years, so let me just name a few things that we accomplished. We have finalized our vision statement. Our vision is to live in a world where all children, birth to 8, are safe, healthy, and inspired to lifelong learning. We finalized our mission statement. The National Early Childhood Family Network is a network of families and agencies committed to increasing awareness of early childhood experiences by providing resources and training to families of young children. We aim to bring families together locally and nationally to increase our collective voices and to advocate for policies and educational research that promotes the well-being of young children in the family regardless of race, religion, and socioeconomics. Let me also state that with the collaboration of FREDLA and the University of Maryland, we were able to create and develop with great presenters 3 webinars. Our last webinar, which we were a part of, where one of our family ambassador, Ms. Badana Williams, was able to utilize her voice, her impactful voice, and tell her story. That webinar was the importance of understanding trauma in young children, a family perspective by Badana Williams. With that being said, that's only a few things. I would like next to introduce someone who's a state parent leader for New Jersey Early Childhood Initiative, who will present on CDC's Learn the Signs, Act Early, and New Jersey Help Me Grow. But on a personal note, I want to say this young lady has been a very important mentor to me for building my capacity as a parent leader. A while ago, she gave me a wristband, and on the wristband it says, "Be the change that you wish to see in the world." And that's been my goal since ever. With that being said, I'd like to introduce Deepa Srinivasavaradhan, and hopefully she don't kill me for killing her name. Deepa?
Thank you, David. Thanks for that introduction and for saying my last name correctly. And thank you for that. And thanks to everyone who has made this webinar possible. As David introduced me, I am the state parent lead and for New Jersey's early childhood systems. And my goal here today is to join David in sharing a little bit about how early childhood systems are aligned in New Jersey, why development should be monitored, and how developmental monitoring can be done using the CDC's Learn the Science Act early materials, as well as some of the activities of New Jersey's Help Me Grow, as well as how parent leadership is infused in our initiatives. Next slide, please. So looking at the landscape of the early childhood systems in New Jersey, you can see that we chose the flower from the Help Me Grow logo as the layout for this poster. So the 5 petals represent the 5 place-based communities of our early childhood comprehensive systems coin work, and they are all a very integral part in piloting the Ages and Stages Family Access Portal and completing the developmental health promotion activities in our state. And then the lessons that we learned from these 5 place-based teams have been very helpful in scaling up the efforts across the state. So which we will be talking a little bit more in detail as we go through the presentation. Next slide, please. So why should development be monitored? I think I will be preaching to the choir, but just real quick, I just wanted to say, we all know that studies on early brain development confirm the importance of positive early experiences. So importance of positive early experiences in a child's life. And then there's also dramatic growth happening during those during those early years of the child's life. And we need to create that awareness about developmental milestones and what to do when concerns are identified, so parents can address the delays promptly to ensure better outcomes for children. Next slide, please. And these are just some statistics for what happens when developmental delays occur in young children, from autism to other developmental disabilities. I'm not reading the statistics, but one important point that I would like to highlight is that many children with a developmental delay are not identified until after entering school. So that and the fact that early intervention can have a significant impact on a child's ability to learn new skills, I think it highlights the importance for parents of young children, as well as professionals who serve them and work with them, to identify developmental delays as early as possible and connect them to services as early as possible. Next slide, please. I just also wanted to quickly talk about the difference between developmental monitoring and screening. Monitoring is an ongoing process that begins at birth, and it can be done by parents, teachers, and health professionals at any time. One of the sample tools, which I'll be talking a little bit more in detail in the next couple of slides, is the Milestone Checklist. It shares information for parents to review to see if their child is meeting the milestones. And it's a quick, easy checklist, and there are also activities provided by the CDC to encourage the development of those skills in young children. Developmental screening, again, is a little more of a formal process, but it is still completed by parents, but it's using a validated screening tool. American Academy of Pediatrics provides recommendations to complete screenings at 9, 18, 24, or 30 months, but parents need to know that it can be completed at any time and can be requested or at any time through their pediatrician or through other early childhood providers, Help Me Grow, and other early childhood providers. Next slide, please. So the CDC's Learn the Signs Act Early materials are developed by CDC and the Centers for Disease Control in conjunction with the American Academy of Pediatrics. And they are mainly focused on engaging parents in becoming better partners in monitoring their child's development. They are objective and research-based, so you don't have to worry about the authenticity of the information. And the best part of it all is they're all free resources for parents. They're available online, and limited quantities are also available for disseminating to families through the CDC website, which I'll be sharing again. Next slide, please. So I'll be talking about all the resources that are available through the CDC, but I also wanted to share that Jane kindly put together all these links into a single handout that is being shared with you through the chat, I believe, and will also be sent to you after this presentation. But and that's a single place where you will find all these links. Of course, if you go to the CDC website and type in Act Early, you can also access all these resources. So the first thing I'm going to talk about is the Milestone Tracker mobile app, especially in this time during the pandemic. It's easier for sharing with families and having parents download this app on their mobile phones. It is available for the Android and Apple phone. It's parent friendly, and it has checklists for ages 2 months through 5 years of age. There are photos and videos that illustrate milestones, and there are personalized milestone summaries that can be easily shared with the child's pediatrician, tips and activities for supporting the child's early development, and including what to do when there's a concern. There's also reminders for appointments. The best thing is there's not a lot of personal information that you need to share through this app. Just by putting in the child's date of birth, the app would help you track your child's development. Next slide, please. So the milestone checklist, which I spoke about a couple of slides earlier, these are the checklists that are embedded in the Milestones Tracker app, but these are also available as separate checklists for 2 months to 5 years of age that you can download from the CDC website. And if you are a professional working with families, you can print them out and share them with the families, depending on the age group of the child they have, and it addresses the 4 domains of development and the developmental red flags. It can be also printed with Spanish translation on the reverse. And the other thing that I wanted to highlight about all of these materials is that they are all available in English and Spanish, and some are available in other languages as well. You can check them out on the CDC website. You can also reach out to the Act Early team at CDC if you would like to translate into additional languages that are already not available, or if you would like to customize them to meet the needs in your state. Next slide, please. Milestone Moments Booklet. Again, it's a compilation of all the milestone checklists, and it's intended for parents to use throughout the child's early years. It helps parents to prepare for well-child visits. Next slide, please. So the next 3 slides, starting here, are going to highlight 3 wonderful children's books that have been created to highlight the importance of early literacy and providing a resource for parents to interact with their children. So Amazing Me is one of the first books that were created. Next slide, please. And Where is Bear is again was the second one, and it was targeted for ages 2 to 3 years of age. And the next book is The Baby's Busy Day, which is the newest board book for ages 1 to 2. All these books are fun stories that can be read to young children, while also highlighting the milestones that the children should be reaching at those ages. Next slide, please. Watch Me training, again, for those professionals on the line. It's a free 1-hour online course, and it's a wonderful training. All the 4 modules can be completed within the hour, and it talks about why monitoring is important, and even tips on how you can talk with parents about their child's development. Next slide, please. So these are some additional resources. There's a free library of photos and videos of children showing developmental milestones. There's also a Milestones Matter Facebook page. Again, the posts, especially during this time when we're all working virtually, it's very helpful to share the posts that already come through the Milestones Matter Facebook page. Next slide, please. There are also tips and fact sheets that have been developed. There are tip sheets for parents on how to help their child and how to talk to their child's doctor. There are also tips for professionals who are working with parents about developmental concerns. Next slide, please. So with that, I think that's a good segue into talking about Help Me Grow efforts in New Jersey, which are focusing more on the developmental screening efforts. So Help Me Grow New Jersey has been aligned with the New Jersey 211, and that serves as the central statewide telephone access point that connects families to their local county in central intake sites for Help Me Grow care coordination. So central intake is available in all the 21 counties in New Jersey, and it connects pregnant women and families with children birth to 5 years of age with a care specialist who can help with their individual needs and link them to services in their community. Next slide, please. So this is one of the tools that we use through our central intake sites as well as through our early childhood specialists. This is the Milestones brochure from the CDC that has been customized for New Jersey. It has New Jersey specific information. It has contact information of New Jersey's early intervention, child find. It of course lists the Help Me Grow 211 number, as well as the SPAN Parent Advocacy Network, which is the one-stop for families in New Jersey for receiving information, training, and support. Next slide, please. So this is another resource that we were able to create in New Jersey. I shared this idea based on the information that I received through one of my Learn the Science Act Early Ambassador trainings. And our team was really quick to act on it and help in co-creating this child development passport. These passports are used as conversation starter, and I just tell families that it's really helpful if they are able to use it along with the Milestone Moments booklet that I talked about earlier, because that is a resource that references the milestones that children should be reaching between up to 5 years of age. And this passport basically is a tracker that helps them track what screening has been done, when it has been done, what follow-up services can be have been connected to, etc. I wish I could show an overview of this passport, but unfortunately, it's not possible to show video today. But one of my colleagues has highlighted an article that I wrote about the developmental passport and how it can be used in the chat box. Thanks, Lauren. Next slide, please. So, so we talked about the tools that we developed. Next, I also want to talk a little bit about the Ages and Stages online family access portal. that is available through all the central intake sites in all the 21 counties. So we, as I said, we started off with the 5 place-based teams of the ECCS coin work to start piloting, and then we used the information we learned from that pilot project to scale it up to the rest of the state. We started off with 156 screens last summer, and then as we scaled it up throughout the state during the fall of 2019, we have come up to 686 screens, which was the number I received when I was completing these slides. And as of yesterday, the number was 741. So it is ramping up, and we're able to see the impact of doing the developmental health promotion activities with our early childhood specialists, central intake staff, ECCS teams, and our parent partners. So some of the outreach activities are, reaching out to childcare providers, physicians, libraries, working with other community-based organizations, and some of them are even having success working with their early intervention and in their counties. So all that is really exciting information. But I just want to, I think I've talked a lot, but I've, and you're all really waiting to hear from David. So I want to give him an opportunity to talk about some of the parent leadership activities that he has been involved in through his work with our team. Over to you, David.
Thank you, Deepa.
There was a question that came in real quickly about what the literacy level was that the passport was written in, and I wondered if you could answer that real quickly.
The passport is a really basic tool. If you are able to click on the link, and you're able to see it just highlights. It's just a tracker. It's going to talk about what the importance of developmental monitoring and screening, what they are, what the difference is between the two, and it's basically a tool that parents can. It's like a sheet that they can record information, just like the wellness tracker that a parent would use to track their child's height, weight, immunization, etc. So that is also in one of the pages of the passport. So basically giving the parents an idea that it is a tool to track the child's wellness as well as the development. So in terms of tracking development, it also highlights the recommended ages when the screening can happen. And then there is space to record what tool was being used and the results of the screening, and any follow-up services was a connection made, etc. So this is just a basic tool and doesn't require a lot of literacy, but at the same time there is some amount of explanation that is provided as we disseminate these tools.
Okay.
I hope it answered the question.
Yeah.
Next
David?
slide, please. Yes, next slide, please. On the next slide is the Help Me Grow Early Childhood Comprehensive System impact on parent leadership activities. I'm part of the county of Essex County and part of the state impact team. The planning and implementation, I'm just going to read a couple of these on for time's sake. The planning and implementation of the Family Access Portal. Family Partners was very important with this in implementing this, because they did surveys on how it would be best to go about doing this. And, I'm sorry. So, they had our feedback. And let me just go back a little bit. In relationship building as far as parent leadership, New Jersey is known for family engagement. We didn't always have a smooth relationship. It started off kind of rough. I mean, I had to learn and earn their respect, and vice versa. It works both ways and stuff. And they, they learned to earn my respect, and they had to know that they was intentional when it came to parent engagement, especially fathers. So going back, the SQ, the Answers to the Staging Questionnaire training, we were actually training also on parents, not to conduct them, but to be a part of like a peer-to-peer, to talk to parents and tell them how important it is to actually do that screening and do that assessment. This year actually did feature me on a blog on my journey through the children's systems of care, trying to find services and support for my grandson who was diagnosed with special needs. With my team members and mentors able to pour into me rich information, I have been able to go to different events and conferences and sat on panels with doctors, PhDs, directors of early childhood development organizations and such, and being able to give a parent perspective, and not just a parent perspective, but a male perspective, because most of the social services, and don't get me wrong, I love the women, I love what you do. I wouldn't be in the position that I'm in now if it wasn't for the love and support and the energy that I get from my state team, which is a majority women. But mostly it's women in social services. So it's kind of hard to change the mindset when it comes to engaging dads, which we'll get to later. Next slide, please. Act Parent Champion for Development Health Promotion. I try to utilize my platform. As you can see, we go to the library, we go to children activities, we go to the WIC office, we go to the laundromat, but I also use my platform as a PTO president of my grandson elementary school, which I have over 730 students from preschool to 7th grade. Next slide, please. This is near dear to me. During one of my times on the Early Childhood Development Committee, I developed this, what I call the 4 E's, when it comes to parents and family leaders and how you engage, especially how you engage fathers. Because like I said, we need to make sure that we invite fathers in to sit at the table. We need to make sure that organizations are father-friendly. I mean, do you have pictures of fathers and their children, or is it just the moms and their children? I used, for example, when we're changing home visiting. Home visiting was basically the child was priority, and then it went to 2gen, and it went to the mother and the child. But if I'm not mistaken, the father's been part of the family structure for a very long time. We need to encourage fathers to be a part of the work that we're doing, because data and studies show that when fathers are involved in their child well-being at an early age, they do better socially and emotionally when it comes to school and other things like that. So just to go over my 4 E's real quickly, you have to engage parents. Well, let me just say the state of New Jersey used this against me. They engaged me by meeting me on my level, not on their level, not on their professional level. They built that trusting relationship, and they brought me up. They educated me on the services and resources that are available. They empowered me to be a strong advocate for services needed for all children. As you can see, I'm presenting this webinar with one of our state leaders, which is fantastic. And they encouraged me to be a voice of change. Like I mentioned earlier, Deepa gave me a wristband that says, "Be the change that you would like to see in the world." Next slide. Deepa.
Thank you, David. David is definitely a champion for all the wonderful work that we are able to do here in New Jersey, and I'm so happy and honored to be serving along with him. The next few slides are just quick resources that I will just quickly highlight. This is an article that I wrote about early identification of developmental concerns in young children. The link is provided here at the bottom of the slide. It includes tips for parents as well as professionals that work with families with young children. Next slide, please. This is an overview of the developmental screening access points in New Jersey. Again, this was developed by a parent professional who works with us on the Help Me Grow team in New Jersey. Her name is Nicole Hopkins. As part of her LEND project, she was able to complete this overview of the different access points in New Jersey. Next slide, please. And this is another poster that we developed based on the initial poster that we had with the aligning early childhood systems in New Jersey slide. And then we were able to give some verbiage and provide information on how we have aligned developmental health promotion across all these initiatives. Next slide, please. And this was an overview again when we had the opportunity provided by Help Me Grow National to participate in a Frame Lab training around messaging. I was invited to be part of the training along with the state team lead, and we were able to work together and come up with this one-page overview using the Frame Lab messaging strategies. Next slide, please. So these are all just basically examples of how parent leadership has been helpful and infused in all the activities that we do. And thank you all for listening. I'm happy to answer any questions, and I'm sure David would be also towards the end of the presentation, and I'll also address some of the questions in the chat box. Thank you.
Deepa, before we move on, there is one question about the screening, the AGS screening. And the question is, how many are repeated for a child? That is, do parents use this for a child over time?
I may not be the best person to answer the question, but from what I know, I believe that once parents complete the questionnaire, they are connected to the central intake sites where specialists reach out back to them with the responses or basically the information that they have completed as part of the questionnaire and any follow-up resources and recommendations, and then they are offered the opportunity to complete. But again, it's parental choice, but it is offered to parents to complete over time.
Okay, great. So those of you who have additional questions for Deepa or David, you do see Deepa's contact information. Somehow David escaped having his email posted for the world to see. But there will be an email sent out to everyone who has registered for this with a recording of this webinar. So the additional question is, yes, it will be available. So thank you, Deepa. Thank you, David. That was a wonderful overview of Jersey. I'm ready to move. But before I decide about moving to New Jersey, let's hear about Connecticut. And so we have an equally astounding group of presenters from Connecticut. So if I could turn it over to Luz, yes.
Yes, hi. Good afternoon, everyone. Buenas tardes. It is a privilege to be here and share this time with each of you. I am joined by a group of presenters. Karina and Beth Ann will be sharing this PowerPoint together. I am a program liaison for the Office of Early Childhood. And so I oversee home visiting programs across the state, and I'm also the lead program coordinator for Help Me Grow. And so it would be remiss of me not to mention that Connecticut is the founding father or the founding state of Help Me Grow Connecticut, Help Me Grow, and we also house the National Help Me Grow office here in Connecticut, and which is replicated, I think, over 25 states. So we're very proud of our accomplishment, and I am glad to be part of this team. Just a little bit about OEC. OEC was created to improve the delivery of early childhood services for children in Connecticut. Our vision states all young children in Connecticut are safe, healthy, learning, and thriving. Each child is surrounded by a strong network of nurturing adults who deeply value the importance of the first years of a child's life and have the skills, knowledge, support, and passion to meet the unique needs of every child. The OEC is a state agency that oversees the network of programs and services that focus on parents and providers to help young children grow and thrive. And a key part of our work is supporting the providers, teachers, and other professionals who have dedicated their careers for caring for and educating children. We consist of 4 divisions outlined above. OEC works very hard to support and strengthen families in Connecticut. We help parents find and pay for high quality, licensed childcare and camps, inspect and license childcare programs and camps, and so parents can trust that their children are in good hands. We also oversee the early childhood home visiting programs across the state. I oversee 2 regions out of the 5 in total. We have close to 16 contracts, and so there are many, many opportunities to strengthen families in home visiting. We also oversee the Help Me Grow contract along with CDI and other partners. We offer training and resources to help parents build their parenting skills and oversee programs for families with children who have developmental delays and disabilities. Bottom line, we help protect children and prevent child abuse. And so I'm very proud of that. The next slide, please, Janet. The early years matters and offers an incredible opportunity to build a strong foundation for families and children. Family of young children can benefit from an organized system of community resources to help them grow and thrive. The Help Me Grow system is built on this premise with 4 core components to offer and support positive early learning experiences and parent support. There are 4 core components, which is the centralized access point and CDI, which Karina will be sharing information. The family and community outreach, which builds parent and provider understanding of healthy child development and support services available to families in the community, and which are very important to improve children's outcomes. We also, Help Me Grow also focus on the potential concerns to ensure that early identification is identified. And so they do that through child health provider outreach, supports early detection and intervention, and connects medical providers to community resources to best support families. And lastly, to make sure the system is working effectively, data collection and analysis supports evaluation, helps identify systematic gaps, and bolsters advocacy efforts and guides quality improvement. So I really would encourage you to go to the Connecticut Office of Early Childhood to learn more about our program and services, along with the National Help Me Grow, which offers many resources to support systems change. And so I will now move on, and Karina will be talking to you about CDI and the importance of developmental screening. Take it from here, Karina.
So as Luz talked a little bit about, was that Connecticut was the first Help Me Grow system in the country. We started in 2002 and have served as the model for other Help Me Grow systems that have evolved over the last 10, 12 years. So I'm not going to repeat some of these pieces here because Luz already started to speak about them. But one of the things is that we are guided by an advisory committee of early childhood stakeholders and champions. And this advisory committee actually evolved out of our ECCS grant that we had several years ago. And we have established this group in partnership with families in order to coordinate and integrate equitable early childhood efforts within the state. Next page, please. So I'm going to talk to you a little bit about Child Development Infoline. This is a specialized call center within United Way of Connecticut's 211 system. And we actually focus on really supporting families who have questions or concerns about how their child is learning, developing, or behaving, and to connect them to the best services available in their community. We are telephone-based care coordinators, and they can reach us through our 211 line, but we also have an 800 number that families can contact us through, as well as providers. Child Development Infoline actually started in 1993 as the access point for Birth to 3, which is our state's early intervention program. And we are the single point of entry into Birth to 3 in Connecticut. So we take all those referrals and provide the intake and information for families that are interested in receiving Birth to 3 services. We also help families connect to early childhood special education services, which is through the local education agencies, and is comparable to Birth to 3, except for that they really provide the evaluations and services for kids 3 to 5. And we can also help families who have older children try to connect to those kinds of special education services if they have not been identified earlier or need some support or advocacy in receiving those special education services as the children grow older. A couple of the other things that we really are the access point for include the Children and Youth with Special Health Care Needs program, which is in Connecticut, has 5 regional medical home sites that really provide some more intensive care coordination support for families whose children have delays or behavioral or physical problems that are long lasting. And that has expanded our role to not only serve pregnant women through age 5, but we also serve children and their families throughout childhood. The last program that I'll talk about is Help Me Grow and our Ages and Stages program. Help Me Grow, it was really designed by Dr. Paul Dworkin in Connecticut, and really with the focus being that there are a lot of different supports and services out there for families, but a lot of families really don't know how to access those supports. And many of the kids, because in Connecticut especially, we have a pretty stringent requirement for eligibility for Birth to 3 services. There are families who may need to access other kinds of resources to support their children's development, such as home visiting, such as family resource centers, parent education programs, family support systems. And as part of our Help Me Grow system, we also offer for any parent in Connecticut who is interested in tracking their children's development over time. They have free access to the Ages and Stages developmental monitoring program. And that can be done either through a mail-out version or through an online version through a family access system such as New Jersey described. So we have had many families connect with us in fiscal year 19, which is the last year where we've really done some extensive compiling of data. We had over 21,000 calls through Child Development Infoline, over 10,000 referrals to our Birth to 3 early intervention services, 2,600 referrals to Help Me Grow, and have during that year had over 10,000 families that were enrolled in our ASQ system, with about 2,000 new enrollments that year. We also have developed a website where families can get information on all these different resources, and we have a section on Learn the Signs Act Early, and have really integrated the CDC's developmental and tracking information into our website. One of the other things that we have started to do, and we will probably be talking a little bit more about this later, is really working with communities who can actually have their own access module for their community or for their particular program and actually do their own monitoring of the children in those particular services, which is really enhanced our ability to be able to reach more families around their children's development. Next slide, please. So I'm going to probably repeat a little bit of what Deepa had talked about because obviously screening is very important. Approximately 15% of children have or are at risk for delays. And really the early identification and connection to services is so critical to ensure that kids are growing up and ready to learn when they enter kindergarten. Next slide, please. This is just a really, vivid statistic about why it's important to do a formal screening versus just using observation. You can see here that without screening tools, only 30% of kids were identified with developmental delays, whereas when a formal screening tool was used, 70 to 80% were identified. And the same thing can be said for children with mental health concerns. Without a formal screening tool, you may be able to observe that this child might need services, but you will identify and connect more children by using formal screening tools. Next slide, please. We think about screening as part of a continuum, and the first being developmental awareness and promotion. And this is for all children and very important that every child really has some of these activities. And this is where Learn the Signs Act Early really is a great tool for this particular part of the continuum so that families really have an understanding of how their children are developing, have a way to talk about it, have a way to think about it, have some promotional activities that can support their children's development. In addition, all children should have formal screenings, and that can be done in a variety of different settings. But it's important to have regular developmental screenings to ensure that children who need the additional supports are identified early. If there's a concern, we will need to get more information, talk to the family. Sometimes you can find that last week they did the screening and their child wasn't walking and a week later they are walking. So things do change quickly over time for kids' development. So it's important to have the conversation with parents. They may want to speak with their pediatrician and make a decision about whether they would like to have a more formal evaluation through early intervention, through our birth to 3, our preschool special education, or other services. And then, of course, ongoing monitoring is important for all children so that we're continuing to look at development and make sure that we are catching any children that may need additional supports. Next slide, and I'm going to turn it over to Luz again.
Luz, you may need to unmute yourself.
Thank you for that. I was having a whole conversation. So thank you, Karina, again, for setting the stage regarding screening as a continuum and how we in Connecticut look at that as a continuum of process starting with awareness. And so I will be sharing with you the different ways that we enhance that system or that continuum, and we begin with the ways that we touch providers and parents. And so to promote developmental screening, we call them touch points. And so Karina just shared with you the ways that Child Development Infoline does that, and both the paper version and online version is available. I also wanted to share with you that the OEC Early Childhood Home Visiting programs across the state are required to complete both the ASQ and the ASQ-SE with all enrolled families. And so the home visitor brings the ASQ questionnaires. For the ASQ3, there is 21 questionnaires in total, and you can start screening as early as your child's first month all the way into that child is 5.5 years old and ready for kindergarten. Once that child has been identified, of course, screening then cease and early intervention, if eligible, takes that step forward with that child. And so right now, the total numbers of completed ASQ through our home visiting services consists of 1,847 children. We have identified 434 children with some delays, and out of those 434 children, 214 of them, 49% or so, at least one referral has been provided. And then out of those 214 children, 167 have actually received intervention. And we recognize that these numbers are low, and the reason for that is because some of our home visiting programs are still trying to get on board with our ECIS data system. And so we estimate that these are just a fraction of the children enrolled, and that we actually have a much higher rate of ASQ screening. Community initiatives, I want to just highlight the fact that in 2013, Child Development Infoline, I'm sorry, that's my dog in the background. Child Development Infoline was awarded a grant from Grossman Family Foundation. The Norwalk initiative consists of both state and local partners. Goal is to ensure Norwalk children will enter kindergarten developmentally ready to learn. I'd like to highlight some of the strategies that are underway with this initiative. They increase routine screening as early as possible. They provide ongoing developmental promotion to support all children in this community. They identify children with developmental concerns and connect them to services as needed. They use relevant data to inform decisions about resources, allocation, protocols, and policy. Some of the strengths of this initiative consists of that the Norwalk Early Childhood Council adopted a policy mandating that all school readiness programs must use the ASQ to screen children, also including their home visiting programs within that community. And lastly, they also include the ASQ in their kindergarten registration packet and share it with their teachers. They also have an ASQ community liaison who is responsible for supporting and overseeing all providers utilizing ASQ, engaging new providers in the work, and that may be faced with developmental screenings for Norwalk. To date, from 2013 to 2019, they have screened 5,170 children in that community, and 2,927 children have received at least one screen. Number of children with repeat screens tracked over time consists of 1,055. And so a little bit of also an area of touch points is the primary health providers. The Child Health Development Institute, CHDI, is fully responsible to advance and inform improvements in primary and preventative pediatric health and mental health care programs. So they actually have a module on Help Me Grow in developmental screenings to promote developmental screenings in pediatrician settings. Lastly, another touch point in Connecticut is the Sparkler app, which is funded and being piloted here in Connecticut, funded by OEC, I'm sorry. It is a pilot for early care and other providers to help improve child developmental screening, communication, and promotion with families through an interactive app-based technology. We started in 2018 with 2 local communities, and now it has expanded to 6 additional communities in various settings, such as federally qualified clinic, WIC office, home visiting, family resources, and early child programs. And currently, due to the COVID-19 climate, unfortunately, we also have moved forward and encourage all home visiting programs to start using the Sparkler app, because virtual reality is in the air due to the COVID-19. So we thought this would be an opportunity to ensure that we continue our screening efforts with our families. And so Sparkler measures and monitors child development, ASQ3 and SE, because the companion tool is the Ages and Stages Social Emotional Questionnaire, which gives about 9 questionnaires or 9 opportunities where parents complete this tool to monitor their child's social emotional development. And so the app has over 1,200 ideas for activities for parents and caregivers that they can use and play with their children. It follows child's progress, and it also connects families to get extra support. We have screened through the Sparkler pilot 1,123 screens in the ASQ, and then 235 in the ASQ SE. As for our home visiting programs who just started to use the Sparkler, we're up to 238 children signed up. And so the Connecticut-Screening to Succeed is an initiative with great representation of early childhood champions across Connecticut. And this is another way that we touch families and providers for developmental screening. And our focus was to hold a call to action to ensure the success of all children through promotion of early screening, developmental awareness, and the power of community connections. And so I am going to move on and allow Beth Ann to share with you a little bit about the Screening to Success initiative. Thank you.
Hi, good afternoon. So I am going to talk about the initiative that we started back in 2018. Is we developed a work group of different partners from Title V, our Learn the Signs Act Early Ambassador, our Office of Early Childhood, Help Me Grow, the 211 Child Development Infoline, many other early childhood providers to develop a call to action that would ensure all success for all young children through the promotion of early screening, developmental monitoring and screening awareness, and then how we can bring all the community together and connect so that we all can screen young children. So we started off with a conference that we had some national speakers come in June of 2018. And then about 6 or 7 months later, we decided to do a follow-up to that conference by doing regional meetings throughout the state. So we have 5 regions in our state, and we set up a meeting in each of the regions, and we brought all the early childhood providers back together, whether it was home visiting, teachers, pediatricians. It was also some state agencies, WIC, and then we also had some of our dental programs there. So we all came together, we did the same discussion on what we can do in each of our regions to support young children, support monitoring, how can we implement screenings for all, anyone who comes in contact with a child 0 to 5. So those were really successful. If you can go to the next screen. So those were really successful, and then after we finished all 5 of our regions, we took at each of the regional groups, they all developed an action plan on what they wanted to do in their region and how could they support each other. So you would have a home visiting program that was using ASQ, and you would have an early childhood program that some of those kids went to that. So how can they build those connections? So what we did was we had everyone develop an action plan of priority areas that they wanted to work on in their program/region. So we brought all those action plans back together, and we, as our work group, we went through them and we saw top priority areas, which were to improve outreach to families. Specifically, we wanted to work with some more fatherhood groups. One thing that a lot of programs did specifically state they struggled with was cultural competence. So how can they reach out to families that speak different languages? There was an increase of immigrant families coming to Connecticut. So we wanted to make sure that our programs had all the resources to be able to work with families of languages that they weren't as familiar with and not as predominant languages in Connecticut. And then also too, working with primary cares. So really developing a relationship with the primary care doctors so that if preschool classrooms did screenings, are they sharing the information with primary care? So it was all about bringing information back together and sharing it for the purpose of that child and all young children. So one of the other priorities that everybody talked about, and one of the supports they all talked about, was the financing the work that they wanted to do. So how can we buy more ASQ kits for all programs? So a lot of programs were stating that they needed it, and they wanted to be able to use that online system that Karina talked about. So that was one of the things that we were next working on, and then we hit COVID. We were going to be doing a webinar on those top priority areas that each of our regions were asking, and we were going to have some speakers. So we kind of hit a little glitch in our work efforts. So, but hopefully soon we're going to be getting back together with the regions and kind of seeing where they are. And we're actually about to apply for a grant through Learn the Signs Act Early that would support families during COVID. So we're hoping that Connecticut will be one of the states that is selected. So that will help us in our screening efforts, especially now. We know that in our state, a lot of birth to 3 referrals are down, and a lot of families are not really doing any more reach out. So we want to improve those interactions. So that's about what we're doing here in Connecticut. Does anyone have any questions?
Have the contact information for all of the presenters from Connecticut. I did have a question about the Sparkler app. First of all, I want to know who thought up the name. It's wonderful. But with the link to the Sparkler app has been added in there, and sounds like it's also been linked to pediatric practices, which is phenomenal. So with that, Tish, you want to introduce, and by the way, now I'm in a quandary whether it's New Jersey or Connecticut. Both programs sound wonderful. So Alabama.
Jane, we're going to bring you here to Alabama, so you don't worry about it.
Okay.
All right, everybody, thank you. And I would like to turn the time over now to Katie Prince. She is our Help Me Grow Alabama Director, and to give you an update of everything that's happening here. So, Katie, take it away.
All right, thanks, Tish. Hi, everyone. Well, today I will be sharing how we are implementing Help Me Grow here in Alabama, including a little bit how the program got started, and then how it's really been partnerships that have allowed us to continue to grow and sustain the needed support to continue serving families and providers here in Alabama. The organizing entity for Help Me Grow in Alabama in our state is the Alabama Partnership for Children, which is a statewide nonprofit focused on supporting families with young children birth to 5 years old. So like our vision states, every Alabama child will have the opportunity to succeed in life. In addition to Help Me Grow, our agency houses multiple programs that support this mission, including the Teach Scholarship Program, the Center for the Study of Social Policy, Strengthening Families Framework, and I apologize, I did not say next slide. I'm still on the previous slide. I apologize. Early childhood, I just got started talking. Early childhood obesity prevention work. We also house the Talk With Me Baby and Read Right from the Start programs, which focus on early literacy, and coordination of the state's infant early childhood mental health consultation work, and of course the Learn the Signs Act Early program and Ambassador, which I will talk later about, and has really proven to be mutually beneficial to promoting early detection and developmental screening across our state. Next. Oops, I think you're on the next slide. Yes. Okay. Yes. Thank you. So I know this might be difficult to read, and I know we all love logic models, but I really wanted to just highlight some of the inputs, or really what makes the program possible in our state. So this includes the national model guidelines and technical assistance from the Help Me Grow National Network, our generous funders and leadership team, which I will highlight in more detail in a second, our database systems, which include a client tracking system, which we license from Help Me Grow Utah, as well as the ASQ enterprise system that the previous states have mentioned from Brooks Publishing. And really, most importantly, and pivotal to our work is our regional partners across the state, which house our care coordinators and Help Me Grow in their local area. So Help Me Grow founder Dr. Dworkin always describes the Help Me Grow model as being elegant in its simplicity for families. However, I think you can see here that there really is a lot of moving parts that make that simplicity possible. Next slide, please. So I mentioned earlier how partnerships have really been the driving force behind our program. And this really started with our Help Me Grow leadership team, which was created in 2011 when we became a Help Me Grow affiliate. And their job and role was really to determine the best way to adapt the Help Me Grow national model for Alabama, and who continues actually to meet quarterly and really is essential and helps to guide our work today. This group was actually put together and built upon from other statewide groups that had been working together on other early childhood work that really aligned well with the Help Me Grow mission. So, and I think this is really something our state has really been good at. Instead of consistently creating new coalitions, work groups, committees, and starting from scratch on building those partnerships and relationships. We've really been able to build upon the previous work and successes of partners from before us. Next slide, please. And I'm actually going to go ahead and say next slide because this one was a little duplicative. So yes. So just a little bit more, one more slide on our Help Me Grow history in Alabama. So really between 2005 and 2010, Alabama was really fortunate that developmental screening really started becoming a focus and a priority, and was supported by previous ECCS work, the AAB-CD grant, which I apologize, I could not tell you what that stands for right now. The ASQ was chosen and accepted across systems as a developmental screening tool of choice, as well as we had some policy, some policy successes. Medicaid and private insurance decided to cover screening at well child visits, so that really made it possible and moved that work forward on really supporting developmental screening in our state. Help Me Grow then became an affiliate in 2011 with a 2-year planning grant from the Help Me Grow National Network, which is when the leadership team again was formed. 211 was actually selected as our centralized access point, and 5 counties in the central Alabama area were chosen as the first implementation site for Help Me Grow in our state. So then in 2014, our state actually became a project launch grantee. And that is actually, if you're familiar, that's a 5-year grant from SAMHSA, which we just finished this past October. So that actually gave us the ability to go from 1 implementation site in 5 counties to 14 implementation sites, 14 counties in 2 regions of the state. Then in 2015, we received funding from the Alabama Department of Early Childhood Education. And this department houses our McPhee funding. It houses our Head Start. We have Children's Policy Council statewide. And most importantly, who we most closely partner with is the First Class Pre-K system, our state's pre-K system in our state. So that really allowed us to go from 14 counties to serving all 67 counties built through those 211 partnerships in the 9 existing regions that were already set up from those 211 agencies across the state. And then in 2016, we received funding from our Department of Human Resources, and that allowed us to not only continue serving all 67 counties, but it really gave us the ability to start focusing and targeting child care providers in our outreach and our support for those providers across the state. And last, our most recent update and change, just because of our growth and our continued involvement since we became affiliates, we made the decision this past year to adopt a new toll-free statewide number and really route all referrals, all processes through our central office in APC, while still partnering with our regional partners to deliver Help Me Grow services in their local area. So we still saw the need and the benefit of having our care coordinators housed in their local communities so they can make those partnerships, identify those resources locally. However, we wanted to just continue making it more refining and making it simple for families and providers to get connected. Next slide, please. So this is our Alabama Access Guide, which again is probably hard for you to read, but this is actually a large poster that unfolds and gives a great visual for how Help Me Grow supports the existing system of care in Alabama. We always say Help Me Grow is not meant to create anything new or recreate the wheel, but is really meant to come in where we're needed, be that safety net, and fill in those cracks where families with young children do not easily fit or qualify for needed services. This was originally created and adapted from Kentucky and put together by the Help Me Grow leadership team as really the first step to mapping the landscape of resources and determining where Help Me Grow could be that support to the already existing systems and services in Alabama. This is really a great tool we give out to service providers to support them in their work with families, and actually has a large amount of state and local, state and national resources listed on the back. Next slide. So as we talked about today, the centralized access point and care coordination components of Help Me Grow, I think, are really the heart of the program. However, I would actually say developmental screening, I think, is the backbone. So it's really what gives our care coordinators a starting point on where to connect those families, identifying those needs, especially for families who come in without needs already identified, as well as being that great parenting education tool for parents to learn and support their child's development. We have really grown in this component over the years, from only offering the ASQ to families at just outreach events, to offering the screening, which we still do, to all families enrolled at regular intervals. So, for example, if a child enrolls at 6 months old, we will send that parent automatically the next age-appropriate screener every 4 to 6 months until that ASQ is no longer valid for a child at 72 months. To now allowing access and providing technical assistance to early childhood programs and healthcare providers across the state to support their developmental screening efforts. So our Help Me Grow care coordinators use the ASQ Enterprise system, and we now allow partnering providers to use that system as well, and really enhance their already existing developmental screening efforts. Our main family outreach event, which I mentioned, is our Books, Balls, and Blocks event, which is an idea we actually borrowed from Help Me Grow Utah. I think this is a favorite for everyone on our team since most of our work is over the phone. So this is really the only chance we get to interact with families and their children face-to-face. We partner with communities across the state. This includes churches, child care centers, libraries, and others, to make these events possible. And then our team brings all of the needed materials to set up activity stations that go along with the ASQ developmental screener. So parents can come to the event, complete the ASQ on site for their child. If they're unsure how to answer a question, so for example, maybe they don't have scissors in the home, so they're unsure if that child can use scissors, they can walk their child over to that station, practice the skill, and better answer that question. We score on site, we discuss results on site, and then a lot of times we like to have resources at tables with tables set up, but we can walk that family over to that resource and they can really have that initial connection right then. So these are really great events that we really have enjoyed over the years as part of our developmental screening promotion. Next slide, please. Next. Oh, I'm sorry. Yes. So again, continuing on partnerships, our partnerships with our local AAP and Reach Out and Read program have really been essential, especially at the beginning of implementation, to getting into the doors of healthcare providers and pediatricians, which we know are often really the only person who sometimes sees families with young children before entering school. So they really are uniquely positioned to identify developmental concerns early, and most importantly, though, refer those children to needed supports. We have participated in multiple continuing education projects around developmental screening, where participating practices are required to increase screening rates, and then Help Me Grow is involved as a community partner to support them in making those referrals. Next slide, please. And like I mentioned before, the Learn the Signs Act Early program is another one of those key partnerships. So our state's Learn the Signs Act Early ambassador, who you heard from, Tish, is housed under the same umbrella with us at the APC. She also wears the Strengthening Families hat. So our two programs have really just been able to support each other, and I think really go hand in hand when it comes to early detection, supporting parents and identifying concerns early, and then with Help Me Grow, making sure they're connected to resources. We have actually adapted some of the materials to include Alabama contact information, Help Me Grow contact information, and we give these materials out everywhere. So we give them to families enrolled in Help Me Grow at enrollment. Always include when we're training providers on early detection and developmental screening and how to connect to Help Me Grow. And we really are so thankful for Tish, who has always been one of our biggest cheerleaders. So Learn the Signs Act Early have really been, materials have been essential in our parenting education component of our program. Next slide, please. So I wanted to continue highlighting partnerships, but these partnerships on the next few slides are really partnerships that have been essential to both reach and serve families. And you will see that these referrals really work both ways. So the first one is home visitation, which obviously is one of our main referrals to Help Me Grow. One of the main referrals that we make at Help Me Grow. We do all of our care coordination over the phone, like I said. So home visitation, I think, is almost an extension of that, which connects the family with someone who will go in their home and support that family and child in their natural environment. Home visitors can also refer families to Help Me Grow if they see a need for additional support, identifying resources, or when those families age out of eligibility, which is common, a common reason for referral to Help Me Grow across systems. Next slide, please. Early childhood education. So this includes primarily our state pre-K system and child care providers. So Help Me Grow has been embedded into our state's first-class pre-K system, really through both developmental screening and resource connection. All parents of children enrolled in this program complete an ASQ at program entry each year, and we support all 1,500 plus teachers in this process by providing training and technical assistance as users in our ASQ enterprise system. And then trying to make sure that all those teachers know that Help Me Grow is here to support them if they identify concerns for a child in their class. So we do this similarly with child care centers and family home providers in our state as well. Next slide, please. Again, EI and special education are often our first go-to resources when working with families in our state. And in addition, though, we have actually partnered with our EI, goodness gracious, early intervention system as part of their EI state systemic improvement plan. And this has really made it where a great partnership where those children at risk for developmental delays who are determined ineligible for services are referred to Help Me Grow, or that information can be shared with those families. So we know there's a delay there, but they just aren't delayed enough to qualify for those services. So Help Me Grow, again, can be that safety net to connecting that family to other resources we're able to locate in their local area. This, again, also is for those children who might be aging out of these services or actually progressing out of eligibility. So again, they've made progress, but there's still concerns that family and child still need support. And so Help Me Grow can again be that support to them to connect them to other services. And then for those children transitioning from early intervention to special education, a lot of times we see this is a lot of times where families can potentially fall through the cracks. So Help Me Grow is a perfectly positioned to support these families and making sure they're connected to resources as well. Next slide, please. So just a really quick slide on our growth since we've been affiliates. In 2014, we submitted our National Common Indicator report to the Help Me Grow National Network, and we were serving 88 families. In 2015, we raised that to 196 families, and we had 288 screens completed. And then this past year, we were serving 1,300 families and had a little over 27,000 screenings completed through our ASQ Enterprise system. Obviously, the bulk of that is through our First Class Pre-K partnership, but we were really excited to see that growth as the years have gone by. Next slide. And just one quick slide on how we've been able to sustain this growth. Again, making it possible where we're still able to serve all 67 counties. Really, the only eligibility requirement to enroll in Help Me Grow is to have a child birth to 8 years old. So regardless of insurance, financial need, language, we serve families of all languages. We have access to an interpreter line, and then we also are so lucky to have bilingual staff members who really can provide more support to our Spanish-speaking families. So that's been supported through our First Class Pre-K funding, from the Preschool Development Grant, which has been essential, the CCDF funding. We've actually been able to really grow our caseload for care coordinators by really engaging volunteers and students, interns in their local areas. And most recently, AmeriCorps members have been essential to supporting our work, especially at our centralized intake part of our program. So we are constantly looking and identifying ways that we can continue to grow and continue to make it possible to support the families we serve. And next slide. Oh, that's it. So please don't hesitate to ask, reach out if you have any questions. We're always happy to share our experiences from Alabama.
Fantastic. Alabama is certainly an equal. Connecticut and New Jersey, obviously, I'll have to move 3 times a year. So Tish, I neglected when I introduced Tish to say that she is the co-chair of the National Early Childhood Family Network with David. So Tish, do you want to see if there are any questions and then wrap it up?
Well, sure. Now, I don't know about questions. I've been looking and watching the chat box, but we will certainly, I think because of time, if we've got questions and comments and if somebody wants to jump in and ask those questions, but let me, before that happens, at least on behalf of the National Early Childhood Family Network, say thank you to some very special folks. We just could not do this at all without you, Jane, and the help of Fredla. We are so appreciative of that. And of course, our network could not be happening if it was not for SAMHSA. And we are certainly very thankful to them, and especially to the TA network that works with us through the University of Maryland for being able to put this on. How wonderful to hear from these states. I wish we could have heard from all of the states and territories, but maybe we can do that over the next coming year or so. But really a big shout out to Deepa and Katie and Luz and Corrine and Beth Ann for presenting for us. I left David out because especially I want to say thank you. He is the co-chair with me on the National Early Childhood Family Network, and he did a marvelous job today. And so a big shout out there. And Gary, for your work of being able to kind of just keep us flowing. I really do appreciate it. And to all of the parents and professionals that have jumped in and listened and have put questions into this chat box, I will stop. And if there are questions, Jane, that y'all have seen, let us know. Thank you.
Gary, Melissa, are there any questions we're missing here? Okay. Gary has put up a survey that's just a few questions to get your feedback on this webinar, and it's very useful to Fredla, to the TA Network, as well as the Early Childhood Family Network in planning future webinars. We appreciate your feedback. So wherever you are, it's almost 100 degrees here. I'm in Maryland. And whatever your plans are for the summer, whether it's the ocean, the mountains, or a staycation at home, please stay well and safe, and all the best in your work for early childhood. Thank you and have a great afternoon.
Thank you.